reason cardiovascular disease is such a big cost to society is partly because it affects so many people. It's responsible for about 160,000 deaths per year across the UK. It accounts for a quarter of all deaths and contributes a lot to health inequalities. It's also very expensive, about £9 billion a year currently spent in England alone on cardiovascular disease. So cardiovascular disease, or CVD, is heart attacks and strokes, and we have done very well over the last 30 years or so in reducing mortality, but the burden is still very high. So I think we've got a responsibility really to do a lot more as the public, as professionals, to improve outcomes for patients, get better value for money, so as patients and as taxpayers. CVD is very preventable. So there's the lifestyle behavioural risk factors, if you like, things like smoking, physical inactivity, obesity. We know that those things all cause heart attacks and strokes and vascular dementia, but they're all very preventable, and NICE has a whole range of guidance which is very helpful for health professionals in helping us to support people to change their behaviour. But there's also a group of high-risk conditions that we treat mainly in general practice. These are high-risk conditions that cause heart attacks and strokes, so high blood pressure, high cholesterol, atrial fibrillation, diabetes, for example. We know they cause heart attacks and strokes, but a lot of people with these conditions are not diagnosed or are undertreated. And so the NHS Right Care CVD prevention pathway has been developed to capture all of those high-risk conditions and show the links to the evidence base, how we could do a lot better at diagnosing and managing these conditions, and that draws very much on the range of NICE guidance that's available. NICE produces a range of evidence-based guidance which has to be at the heart of any solution. So evidence-based guidance that tells us what's clinically effective, what's cost-effective, so what's going to improve outcomes for patients and give us value for money, but also to help us make the case for improvement and the case for investment behind prevention of CVD. There's also behind that a range of products that NICE produces, quality standards, impact analysis tools, for example, shared learning, all the stuff that can help us to implement the guidance. And then NICE has a whole team of advisors. Every region, every STP area will have access to NICE teams who can first of all support STPs and CCGs in implementing the guidance, but also doing quality improvement work, quality assurance work, and where necessary, the NICE teams can help make connections for STPs and CCGs with other teams around the country, other networks who are having similar challenges, trying to find similar solutions. CVD, cardiovascular disease, heart attacks and strokes are very expensive. They're expensive for individuals who suffer these disastrous events in their life. They're very expensive for the healthcare system and the social care system. So the average stroke, for example, costs over 5 years about £18,000 for the healthcare system, about £40,000 if we bring in the social care costs to that. So the benefits of prevention are enormous, and if you look at the size of the prize data that was published, for example, that shows for both improving blood pressure management and improving atrial fibrillation management just how many strokes and heart attacks we could prevent, and overall it adds up to about 40,000 strokes and heart attacks over 3 years and several £100 million. There is a size of the prize for every STP, so at local STP level one can see exactly what the payback is, the return on investment.